Hi, everyone. I'm Ben. Yeah, okay. So I'm a sophomore here. I'm also a research fellow at the Affordable Care Act Implementation Research Network. So that's a 42-state network of health policy experts and officials run out of the Brookings Institution. So for the past 11 months, I've been specializing in Medicaid expansion under the ACA. The past 6 months has mostly been Medicaid reform through Section 1115 waivers, which allow states to basically really fundamentally change the way they deliver Medicaid. So I want to take you through that process of Arkansas's waiver. Arkansas was the first state to apply for an 1115 waiver under the Affordable Care Act. It's called the private option, which basically lets the state pay for the costs of private insurance for the poorest individuals in Arkansas instead of put them on the public Medicaid system. So I've sort of trifurcated the process: development, negotiation, implementation. Starts in September 2012 when Democratic Governor Mike Beebe said, okay, let's support President Obama, let's expand Medicaid traditionally and fully. The Republican legislature, which actually had a Republican majority for the first time in 140 years in Arkansas, was not keen on expanding, as were many Republican state legislatures in this period of time after the Affordable Care Act was passed. So they disapproved. They wanted to go for a partial expansion or no expansion at all. This is where the first stage of negotiation came in, the partisan negotiation between Democrats and Republicans in Arkansas. Again, the Democratic governor wanted to expand, the Republican legislature did not. So the idea for premium assistance came up through that sort of clash, and that's where the idea was developed. It's actually really interesting because a state senator who I have developed a close working relationship with, David Sanders, he actually wrote the legislation that enabled the state to apply for the private option waiver. He actually wrote on a napkin while at lunch with other legislators back in 2012 or 2013 his idea for premium assistance. So we could do this. We could minimize administrative costs. We could increase quality, which I'll talk about on the next slide with the impacts and effects. And so he wrote out this little graph that basically he showed probably a more perfected version to the state surgeon general, the governor's office, and the Medicaid director. So development, the idea is formed through this clash sort of, and that leads to the intra-partisan negotiation within the Republican Party. Since it was Republican, more pro-business establishment legislators writing this, the Tea Party conservatives were not actually in favor. The Republican Party was split over this issue between the more establishment Republicans and the Tea Partiers who really did not want to see an extension of Obamacare, which this really is, even under a different name and a different delivery system. So the Tea Party conservatives ended up not voting for the legislation. It was fine because the Democrats were really on board this expanded coverage, just like a traditional Medicaid expansion would. So then the legislation is passed in April 2013, which leads to about 5 months of Federalist negotiation between the state leadership and the federal government. So that's Department of Health and Human Services, Centers for Medicare and Medicaid Services. They were very active in writing the waiver, which actually the Medicaid